So our wicked problem that we identified was our patients are experiencing loneliness, but we don't have the practice level interventions, the community-based partnerships and interventions, any resources or tools to address loneliness. And we know we don't want to screen unless we have something to do next. So that wicked problem, next slide, Danielle, was something that we then took into PARTNERme, and we were introduced to Danielle. Gosh, I don't know if it was even during the stay-at-home orders or just after, some kind of framing around that. And it was just such a refreshing conversation when we get to meet other people who are thinking the same things, talking the same language. And so we finally had this moment and opportunity to consider what could we invent. We'd been looking in the evidence-based research and identified that we know loneliness and comorbidities of depression, anxiety, also trying to think through the clinicians of ART2 were thinking about things like trauma and primary care PTSD screeners. They also wanted to really sift out what types of social needs were also overlapping with loneliness, because loneliness, it feels like as you keep getting more and more clear on certain things, it becomes more and more complex. Categorically speaking, someone screening positive for emotional loneliness, we would refer to behavioral mental health. If they're screening for social loneliness, then there must be something else there that we can be talking about in terms of maybe quantity of social relationships or learning social skills, and they overlap sometimes too. So we were trying to learn more about what are these characteristics of patients, and then what do our patients actually think would actually help them. And so each of these bullets here has some form or fashion in some studies, but unfortunately, there really hasn't been a lot other than CBT or cognitive behavior therapy to support improved loneliness. So that is why we partnered up with B&L to create a customized version of PARTNERme to help us learn like where people are living and working and playing, and what they actually think would help them, while also gathering this other clinical data.